This year is going to be unprecedented. We are already in the middle of our COVID pandemic, and now we're entering flu season. Last year we got really lucky. Flu season really didn't hit San Luis Obispo very hard. We were really good about our mask wearing, our social distancing. We were staying home. We had no fun. But this year is turning out to be a little different. We've got mask fatigue. How many of you at the earliest opportunity will rip that mask off your face as soon as you hit that door, right? We're getting a little closer. We're missing our friends, so we're getting back together. We're having weddings and ordering wedding candy and getting wine. So all of this puts us in much closer contact with each other. And as that happens, we have the opportunity to pass the flu around. So just a little bit of facts. The symptoms of the flu and COVID are very, very similar. And people, when you have those symptoms, you can't tell the difference. The only way to tell the difference is to get a test. And at Cottage Health, we do the rapid COVID test and the rapid flu. But respiratory symptoms such as cough, congestion, runny nose, body aches, fever, they're not fun. The flu vaccine can help you from getting sick with the flu. It won't protect you against COVID. You need the COVID vaccine for that. But the flu vaccine prevents millions of illnesses and flu-related doctor's visits every year. The flu vaccine, sorry, I'm having trouble seeing this morning, has been shown in several studies to reduce the severity of illness in people who get vaccinated but still get sick. So you often hear, oh, I got the flu vaccine, but I still got the flu. But that person did not get nearly as sick as if they had not had the flu vaccine. And I can say that also goes for the COVID vaccine. People who get the COVID vaccine but sadly get COVID are not nearly as sick or risking hospitalization. Flu vaccine, a 2018 study showed that among adults hospitalized with flu, vaccinated patients were 59% less likely to be admitted to the ICU. And amongst the people in the ICU that had the flu vaccine, they were there 4 days shorter course than those who did not get vaccinated. So even if you get sick, your course isn't going to be as terrible as if you're not vaccinated. The flu vaccine can also reduce the risk of flu-associated hospitalization. And in 2012 to 2015, flu vaccine amongst adults reduced the risk of being admitted to the ICU by 82%. One of the most important reasons to get the flu vaccine is as a preventative tool for people with chronic disease. I'm seeing a lot of, somebody said age-challenged people here in our audience. And we know that as we get older, we do develop more chronic disease. And for those with chronic disease, flu can be really devastating. So the flu will lower your rates of cardiac events amongst people with heart disease, especially if you've had a recent cardiac event. If you have COPD, flu vaccine can reduce your risk of hospitalization or exacerbation of your COPD. Among people with diabetes and chronic lung disease, flu vaccine has been shown to reduce hospitalizations from worsening of your chronic disease. So if you have a chronic disease, not only are you at risk for flu and all that that entails, but your chronic disease may also become worse. For pregnant women, flu vaccine reduces the risk of acute respiratory infection by 1/2. And studies have also shown that the flu vaccine given during pregnancy helps protect a baby for several months until they're old enough to get the flu vaccine themselves. In children, we know that having the flu vaccine greatly reduces the risk of dying and hospitalization. But most importantly, getting vaccinated yourself may also protect the people around you. So if you're not really considered about, I'm strong, I'll fight it, I'll get over it, consider the other people in your life, your friends and family. There's a lot of myths about the flu vaccine, so let's dispel some of them right now. The flu vaccine gives you the flu. No, it doesn't. The flu vaccine doesn't cause illness. It's a killed vaccine. It stimulates your body to provide its own antibodies. If you happen to get sick shortly after you've had the flu vaccine, it probably means that you were exposed to the flu prior to your vaccine or during that 2 weeks that your body was building up the antibodies. Oh, am I getting the, I'm getting, okay, sorry. So, I just want to mention really quickly, because you are Chamber of Commerce people, you're business people, the cost of the flu. The direct cost for hospitalizations and outpatient care is estimated at $10.4 billion. And it's estimated that a person with the flu takes half a day to 2.5 days off of work per incident. I know a lot of businesses are struggling to find people to work, healthy people to work. So imagine if half of your crew gets the flu. So I really encourage you to encourage your employees to get the flu vaccine. So the flu vaccine will protect you, it'll protect your friends, it will save you time and money. And both vaccines for the flu and COVID are readily available, and you can get them both at the same time. I went to CVS 2 weeks ago, COVID booster, flu shot, no side effects. So I hope you'll join me in getting vaccinated and protecting our community. Thank you.